afternoon and a very warm welcome to the ESG Virtual Wellness Series, Keeping Your Bladder Healthy. My name is Terence Koo and I'm your host. Today we're really excited to have registered over 1,500 people across Singapore, Malaysia and the Philippines. This is a new registration record and our deepest thanks goes out to our distinguished panel of speakers. Looks like they're all queuing up to listen to you. The Salvation Army Peacehaven, Home Nursing Foundation, and our sponsors for without your support, this event would not have been possible. Also, a very special thanks to our main sponsor, TENA, the #1 adult continence brand who has over 60 years of supporting individuals and healthcare services. During this event, we encourage you to type in your questions into the questions tab, and we'll do our best to answer all of them, time permitting, obviously. At the end of the event, kindly take a minute to fill in our survey as your feedback is very important to us. In fact, for this occasion, Singapore residents who complete the survey stand to win a great prize in a lucky draw. Kindly follow the TENA Singapore Facebook page for lucky draw announcements and the latest updates. TENA is also running an exclusive promotion for all registrants to redeem some free samples and some great discounts. Please scan the QR code I think it's popped up on the top, or click on the link provided in the chat box. Now, without further ado, let us welcome our first speaker. Our first speaker is Dr. Lim Jit Fong. He is the President, Society for Continence Singapore, for his opening address. By profession, Dr. Lim is a general surgeon specializing in colorectal surgery at Gleneagles Hospital. Welcome, Dr. Lim. So glad to have you with us. The floor is yours.
Thank you very much, Terence. First of all, I want to say a very warm welcome to all of you, the attendees today. Thank you for joining us in such a large number, and I'm very heartened to know that many of you are interested to find out more about how you can look after your bladder and keeping it healthy. I want to thank our main sponsor for today, TENA Singapore. TENA is the largest provider of continence care products worldwide, and they are continually supporting us in educating the public and looking after the public, especially the incontinence sufferers. I also want to thank the Salvation Army Peacehaven Nursing Home Nursing Foundation, and the organizer today, Enterprise Sports Group, for hosting this webinar. A special thanks also goes out to the Singapore Nutrition and Dietetics Association for helping us today by having, we have a dietitian who is going to share with us about a good diet for active aging. So just a quick little thing about Society for Continence Singapore. So we are 30 years old this year. We are a voluntary welfare organization which was started by a group of healthcare professionals, doctors, nurses, and physiotherapists, because the founders felt that the incontinent were suffering in silence, and it is a disease, it is not natural aging. The Society for Continence hopes to educate, train, and empower the sufferers of incontinence in Singapore and around the region, so that everyone can regain their dignity to lead a fulfilling life with no loss in their quality of life. I'm going to hand the floor back to Terence. Once again, I hope all of you will stay on and listen to the wonderful talks.
Thanks, Dr. Lim. Thanks for your opening address. So heartening to hear of the mission and activities of Continence Singapore. Now, maybe it's time to welcome our next speaker. Our next speaker is Dr. Fiona Wu. She is the Honorary Treasurer, Society for Continence Singapore. Dr. Fiona, please.
To make urination, which is a natural process, better for yourself and as well as your loved ones. So to start with, what is incontinence? Incontinence itself is a very common condition, but having it is not normal. It happens to about 14.5% of people in Asia and has adverse effects on a lot of people. For example, social effects. They can't go out, or they are very bothered by it, and they feel that they are being shunned by others. And occupational, it affects their work because they need to go toilet all the time. And domestically, sometimes they will feel uncomfortable, as well as other problems sexually and psychologically. So other than medical side of it, right, there are a lot of adverse effects, right, on the patients when they have this problem. In a prevalence survey done overseas, right, in general, we found that about 70% of women experience some sort of incontinence, but only 30% of the people here find it a social or hygienic problem. So a lot of people experience it, but they do not think that it's a problem, and therefore they actually delay the treatment and diagnosis. So from the International Continence Society definition of urge incontinence is when the patient have involuntary urinary leakage, and just before that they feel very urgent and they are unable to delay the urge to pass urine. So they usually will rush the toilet. Some people rush there in time, so they don't have leakage, but some of them, even before they reach the toilet, they already leak a bit out onto their underwear. So the usual complaints that patient would come and tell us to be, before, when they put the key into the keyhole, right, to the main door, they already start leaking, or even before they actually take down their underwear, right, to void, they already feel it coming out. So this is a usual complaint. Sometimes, right, some female patients, usually female patients, will have a bit of stress incontinence. Okay, I'm going to talk about stress incontinence in the next few slides. So for females, right, urge incontinence is 21%, and pure stress incontinence is only about 12.1%. So in Singapore, sometimes we find it a bit, the numbers are a bit reverse. We don't have that many pure stress incontinence. Mixed is very common, about half the patient. Okay, so I'll talk a bit about overactive bladder urge incontinence first. So for overactive bladder patients, right, they feel they're going to leak even if they've never leaked before. So it's whatever I described just now. They have to rush to the toilet. They are worried that they will leak. So the other older terms that you might see are unstable bladder, hyperreflexia, mean that the bladder is overactive. So when you hear us talk about overactive bladder, right, it's usually a symptomatic diagnosis, meaning that we diagnose by symptoms alone. And it's a bit different from detrusor overactivity, which is what you see here, DO. Okay, so let me get the pointer. Okay, so detrusor overactivity itself, right, it's a urodynamic observation. Urodynamic study, right, is a test we do in the clinic when we see patient and they have very mixed symptoms. So we need to come up with a diagnosis to treat them better. So for overactive bladder and urge incontinence, sometimes it's transient, but some people it occurs over a long period of time, or it persists over a long period of time. So we need to get it sorted out. Okay, but we need to know that it's potentially curable, and I'll talk a bit about the cure later. Okay, so when you see us in the clinic, we will talk a bit, we ask you about history, meaning that what are the symptoms, before that, do you have the problem, any other issues? We will do a physical examination for you. So we will check usually your tummy and maybe your private part to see whether there are any problems that we can solve. Yeah. So you will sometimes this your urodynamic study, which is UDS, to give us a better idea. So for the ICS terms, all these are descriptions that you will see sometimes. Neurogenic detrusor overactivity means that the patient usually has to be a neurogenic problem, meaning that they may have spinal issues, they may have some nerve issue, they may have a previous stroke or common problems like stroke, Parkinson, or even diabetes itself. Idiopathic just means that they don't have any underlying neurological cause for their overactivity. Okay, a bit about the anatomy. This is quite a simple picture that I think is easily understood. So this is a picture of a female bladder and the whole urinary system, lower urinary tract. Okay, above that will be kidneys, which are not shown here in the picture. So this is the bladder. Okay, this is the urethra. Okay, this is the sphincter muscles that control continence, meaning that it must be closed when the patient, when anybody is not voiding, so as to prevent leakage. And these are the pelvic floor muscles. These are the muscles that usually we ask patients to exercise. We teach them how to exercise because this kind of muscles, right, are the same as the muscles in our hands, our upper limbs and lower limbs. They can be exercised. Okay, so a bit about the bladder is controlled by nerves, okay, which is connected to the spinal cord. So usually when the bladder is filled up, right, it will stay quiet, meaning that you won't really feel it until it's quite full and it's time to pass urine. Okay, then with the sphincter muscle will relax, and after that the bladder will contract and all the urine should come out. And of course, the pelvic floor muscle should relax also when you are passing urine. Okay, so the urethra itself, a bit about anatomy. The bladder is this. Okay, it stores urine, and the urethra is a small tube, about 3 to 4 cm in females. Okay, usually for the whole system to function well, it should close properly. The inside layer, right, should be well opposed, meaning that they should close properly. Okay, it's very well vascularized, meaning that the blood supply there is good, and estrogenized, meaning that for premenopausal females, right, the hormones play a very important part in it being closed. Okay, so unfortunately, all these structures can be damaged. For example, for females, right, when they have a traumatic delivery, when they're pregnant, then it can potentially cause damage to the tissues here. Okay, for females, right, they have a higher prevalence of OAB, meaning that there's a higher chance that you get OAB if you're a female. Race is also important. I think the Asians, right, ours is not so high compared to the Westerners. Okay, and of course, when you have a neurologic disease, right, it's a higher prevalence of some urinary issues. Neurologic disease, right, can be even something as simple as diabetes. Diabetes itself, right, affects the small nerves as a patient gets diabetes for a long time. So yes, it will affect voiding. So sometimes I ask patient to check for it. Aging, of course, when you get older, there's an increased symptoms of even overactive bladder. So basically, of course, there are other factors such as menopause as well. Then, of course, all these, when the patient has overactive bladder, sometimes they do have other problems like bowel function. They may get constipation. Actually, it all mixed. When they have issues, right, everything just come together. So they will have different symptoms for everybody. Metabolic syndrome, sometimes the patients have diabetes or obesity. That actually makes it worse. And of course, hormonal status for both males and females. Okay, so a bit about examination. When they come and see us, we check the abdomen. For the gentleman, we usually will do a digital vector examination to check the prostate across the rectum. Okay, then we need to see whether the patient leaks or not. Then we have to grade it. Okay, so for the females, right, we need to look at the private part, see whether everything is intact. Okay, any skin changes, because sometimes when they leak a lot, the skin will become red, and sometimes there are sores and ulcers. We have to check that. For the females, we need to check the vagina. I may put a small little instrument called a speculum to go in and see whether there's any abnormalities and whether any of the organs are dropping out from the vagina. In front, right, will be the bladder, behind will be the rectum, and on top will be the uterus. So sometimes when they strain a lot or there are issues, right, during delivery, these organs will drop out per vagina, and this one needs to get treated as well. Okay, sometimes I ask them to cough and demonstrate to me the leakage, and I ask them to stand or this to see whether any changes in position actually makes it worse. Some patients, even from the act of just getting up from the examination couch, they leak. Yeah, we may take your weight and height, and sometimes we will check your legs or this to see whether there are any issues in the lower limbs. Okay, so investigation, usually we'll ask them to pee, and then we see whether they have a lot of leftover urine. Sometimes we test them for urine culture to see whether there are any active infection, especially bacterial infection, to see whether we can treat it and make it better for the patient. We'll check whether there's any prolapse from the vagina. We may need to do a urodynamic test. Sometimes we do send the patient for scans, such as ultrasound. Okay, we need to check the kidneys and the bladder. And sometimes for, let's say example, there's blood in the urine, we will do a scope, right, to see whether, right, there's any abnormalities in the bladder, any growth or not. Sometimes I do ask them to do PET test, although not common, to see how much they leak. It can be a 1 hour thing, it can be 24 hours. So it depends on what we really need to find. Okay, this is a urodynamic study that you might see. So it's a couch with a machine. So we will put in 2 little tubes, one inside the bladder and the other one inside the rectum. And then we measure the pressure when water is filling up the bladder. So from this, we can tell whether the bladder is overactive or when they are passing, right, whether there's any problems when they pass urine. Okay, incontinence. It's called so-called urge incontinence is when the patient suddenly feel urgent and there is a leakage and the bladder actually abnormally contracts. It can be triggered as something as simple as hand washing. Okay, sometimes some people, they say that when they wash their hand, they feel a severe urge to pass urine. So sometimes it does provoke a reaction in the bladder. We don't know why. Okay, it may not be psychological, it can be real. Okay, so of course, overactive bladder diagnosis is based on symptoms as discussed just now. And of course, we need to make sure that there are no other things such as urinary tract infection, stones, or any tumor. And the most important thing is we may need to do a bladder diary. Sometimes when you come and see us in the clinic, we will ask you to do a chart. This chart is over 3 days. You measure every single drop of water you drink. So let's say example this, right? You see 200 mils. So maybe this is 200 mils of coffee or Milo or fruit juice. So you need to jot out for us and measure the urine using a measuring jug to see how much you urine. This is rather important to us because with this, right, we can tell, we can get a certain good amount of information from here to advise further on medications and whether what further treatment is required. You'll be surprised. Sometimes, right, when the patient voids a lot at night, they think they void a lot, but actually when we measure the volume, it's not a lot because treatment actually differ. Yeah, so usually we tell the patients to try their best to finish 3 days of measuring, although it's not very easy. Okay, how do we manage it? For urge incontinence, we can do it conservatively. We teach your life coping mechanisms. Okay, and then for the both males and females, we can teach your pelvic floor exercise. We usually tell patients not to take too much caffeine. Why? Because the caffeine, right, actually induces urgency and a bit of diuresis in some people. So I know it's very difficult to stop caffeine because we're all addicted to it, right? Either coffee or tea or bubble tea or what, you know. But I think it's a cheap way of treating the problem. In the, you know, when I compare caffeine versus medication, I'd rather stop the caffeine and don't take any medication. Bladder retraining, sometimes I do ask them to try to control their voiding cycle so that you know, they drink enough water and they void, right, every few hours. Usually it's about 2-3 hours so that the bladder capacity can improve. So at night, when they, for example, at night when they sleep, right, they don't get urgent so easily and wake up. Yeah. Then unfortunately for the elderly, right, and of course those patients with dementia, then the caregiver has to learn how to do prompted time voiding for them. So we will sit like children like that, in other words. So we actually ask them to go and sit at the commode or potty or whatever they want to use, and then make them pass urine. All this will help them. And then for the female postmenopausal, I'll give them some topical estrogen to reduce vaginal dryness and atrophy. They may need some medication called anticholinergics and mevrobogon. So sometimes you'll see us giving medications to control the urgency. Yeah. Okay. Then there's a small group of patients who, no matter what you do, right, they still have very bad urgency or leaking. So in the American Association, Urological Association, they define the person who failed all treatment, right? Despite whatever we give them. So of course we must give them a sufficient amount of time to treat, to take the medication and see whether it helps them or not. Usually we'll give them one kind of medication, right, to over about 1 to 2 months to see whether it helps or not. If it doesn't help, sometimes we do change medication or add on medication to see whether they improve on it or not. I think this is important because some medications may not be for all people, for all patients. So we need to have some medication work better for some people. So we really have to try before we move on to other kinds of treatment. Yeah. So of course, there's a small group of patients, about 10 to 20%, despite being on medications, they continue leaking or they are unable to take the medication because of side effects. Then we have to move on to the third line of management. It's more or less more invasive as compared to just taking medication. One of them would be intravesical Botox that we can do it under local or general anesthesia. Okay. Basically, it just involves us by putting in a scope and using a small needle, right, to inject into the bladder with the Botox medication. The Botox that I'm talking about now is the same one as the aesthetics doctor use for, or plastic surgeons use for, you know, wrinkles of the face. Okay, so the effects, right, last usually for 6 to 9 months only. If it works well, the patient has to come back for repeated injections. Okay, some of the complications that you'll hear us say is urinary tract infection, pain when they pass urine, unable to pass urine to completion, and in this kind of situation, we'll need the patient to draw urine themselves using a small tube. Okay, and of course, you need to repeat the treatment if it works well. Okay, we can also do some stimulation of your sacral nerve, which means a spinal nerve. We need to stimulate the nerve and try to get the voiding, right, cycle back in place. Okay, usually we will at least ask the patient to do some tests for us, right? And then at least 50% improvement of symptoms are already considered a success. I really must say this, for overactive bladder and urge incontinence, right? For the Western medicine, we are unable to come up with 100% improvement. So usually we are just controlling the symptoms for the patient. There is no one treatment, right, that will stop it altogether. Okay. But of course, some patients with very mild symptoms, by just something simple as stopping coffee, right, it actually, you know, reduces symptoms by a lot. So unfortunately, for a small number of patients, right, despite our medication and whatever treatment, it still happens. So we at least aim, right, to improve 50% for them, you know, for example, they wake up many times to pass urine at night, right? Because of urgency, from 4 times to 2 times, it actually makes them happy. Okay, so for other for sacral neuromodulation, right, it's a procedure whereby I put a small implant at the back, right, near your spine, so that the nerve is stimulated. Okay, and it helps it helps in modulating or changing, right, your voiding pattern. I think that's important for patient. Okay, this is what I'm talking about. Okay, this is an implant in your spine. Okay, it's just underneath the skin. Okay, what we are doing here is to stimulate the nerve, hoping that, right, at least the patient has less urgency or less leakage. Okay, in case you have seen other talks, right, it can also be used for fecal incontinence, which is uncontrolled leakage of feces. Okay, PTNS, okay, is another procedure whereby we put a small acupuncture needle at the ankle, right, to stimulate the small nerve there, which in turn stimulates the spinal nerve. We use electrical impulses. Usually it's for patients with incontinence and urgency, and those people who failed first-line treatment. Okay. Okay, then usually for PTNS, right, it's a 12-session weekly protocol. Okay, we'll review and see whether they need to continue maintenance, which is once or twice a month. Okay, this is what we see. This is what we, in any way, should tell patients. Okay, basically the small needle there, this is the stimulator, and the patient is very comfortable. They are cloth, they are fully clothed. They wear their clothes, and then they can either read a book or watch some TV, or they do it. Okay, surgical management, not common. Sometimes the bladder is very small. Then we have to attach a piece of bowel there to make it easier, the bladder bigger so that they can hold urine bladder better. This is not common. Okay, usually it's for patients who have congenital problems. When they're born, they have some issues and the bladder capacity is very small, or they have other problems. So this is totally not common. Okay, we talk a bit about stress incontinence. Stress incontinence is when they leak urine, right? When they exert themselves, especially, right, when they cough and sneeze or they have sudden movement. Okay, then they can leak a lot, or they can leak a few drops only. Okay, usually stress incontinence happens to female patients when there's some damage to the pelvic floor muscle or nerves. Okay, and then aging, even aging and low female hormones can have this problem. And then some reversible causes of obesity, and constipation can also be reversed if they stop the constipation. Okay, the stress incontinence can be broadly graded into these 3 severity, either mild, moderate, or severe. Okay, severe, right, is when, right, even a little bit of stress, for example, moving from a lying down position to standing up, they also leak. Mild is when there's a high abdominal pressure, for example, the sudden sneeze. Okay, most people are mild, but there are some with very severe ones. Okay, so usually how we manage it, the history and examination is mostly the same as for urge incontinence. Okay, so we'll skip that part. Pelvic floor exercise, we usually can teach it, or we send to the physiotherapist or specialist nurse to do it. Okay, then sometimes when you see a physio, they have biofeedback. They actually measure, right, how well you do. So it's actually very useful for patient. They need to go for bladder training, which is what I explained just now. Okay, and then we ask them to go to a time voiding. Every 2-3 hours, just go toilet so that they empty their bladder and don't have a sudden leak. Then if possible, we go for weight loss, exercise, don't take too much coffee, don't take too much water. Some people do take a lot of water. That's why the bladder diary is important. If they're constipation, we treat it. If they're cough, we should get it sorted out as well. Then we make sure that the patient, right, does not have things like UTI, which are easily reversible. Okay, for patients with very bad incontinence, grade 3 and above, right, we may need to do surgery, because, right, I think it's very detrimental to their health, socially, or for their work, or for their mental health. Okay, because every time they move, they leak. So it's difficult, and for such patient, I think for a good way, it will be for a good treatment, it will be surgery. So surgery, right, we either lift up the urethra, the urine tube, or we bulk out the sphincter muscle so that they can close better. Of course, for the females, if they have pelvic organ prolapse from the vagina, right, we will need to treat it. Okay, this is a bit about a quick run through about the surgeries that we do. Couple suspension is whereby, right, we actually suspend, right, the side wall, right, of the vagina to a immobile structure in the body. This is a very strong fascia in the body. It's a very strong tube in the body that we can attach the sutures to, so that we lift up the whole system, so that it's actually tightens up everything so that they don't leak. Okay, success rate very good, 85 to 90%. Okay, this has been done for many years, so it's nothing new. Okay, sometimes we do backplate procedure, meaning that we actually lift the urethra surrounding tissues up. Okay, so we actually clean the urethra a bit so it can close a bit better. There are many ways we can do it. We can use slings, biological or synthetic. Synthetic means something like a small piece of plastic. Of course, it's very soft and it's medical grade. Biological, sometimes we do harvest a bit of tissue from the rest of our body, right, to fashion it into a sling, which I'll show later, okay, to do it. Usually, right, we want to do it for simple stress incontinence without previous surgery, because if the patient has multiple surgery, then it's a different, thing altogether. Okay, long-term follow-up of all the slings, right? Okay, the objective cure rate is not bad, it's about 90%. So 77 has subjective cure rate. Subjective cure rate means how the patient feel, and objectively if they don't leak. So for us, right, we see it as 90%, the patient see it as 77%. So overall it's about 70 over the 90%. It's not bad. It's comparable to the birch copper suspension, which is used to be the gold standard, but now TVT is found to be as good. Okay, so this is a pictorial depiction. So basically this is a tape, okay? We sling it up. Either we go through near the tummy, right? Okay, the exit point is the tummy or at the thigh. Okay, this is where it comes out from the tummy lah. Okay, yeah. So basically it just pulls up the urethra, kinks it a bit. Okay, this one is pubal vaginal sling, whereby we harvest, right, the patient's tissue and fashion it into the sling. This one, right, is probably synthetic, meaning that it's a piece of plastic, biomedical grade plastic. Okay. Okay, bulking. Sometimes we do bulking. Okay, we inject a bit of biocompatible substance, right, into the urethra, so that, right, it closes the urethra better. Okay, of course, this one not as good as surgery. 60 to 70% will have some form of improvement. Some people need about 20-30% will need a second session, and over time, right, the outcome is not as good as the previous two treatment plans. Okay, of course, now there's a newer experimental treatment. Okay, we do a bit of thermotherapy, meaning that we use laser. Okay, different types of laser. We put it inside the vagina. Basically, we using laser treatment, right? We actually make the vaginal tissue thicker so that they can lift up the whole urethra better. Okay, this is a day procedure. Patient is awake. We do already. The patient can go home. Okay, it takes about 20 to 30 minutes per patient. We need about 2 sessions, minimum 2 sessions. Okay, during the procedure, right, you may feel a bit of warmth, a bit of pain, and some very rarely will get urinary tract infection. Of course, compared to surgery, the outcome is not as optimal. Okay, because we're awaiting more studies on it. Okay, some centers have it. For example, NUH has it. Okay, but of course, it's on a trial basis, and I'm very sure when you see private gynecologists or urologists, they will have it as well. Okay, so this is what we can offer for patients. And personally, I think this kind of treatment is a bit easier for younger patients to accept, because some patients may not have completed their family. So just now, those operations are not so optimal. And this is, to me, this is a kind of a treatment, right, to tide the patient over until the leakage is bad enough to go for surgery. Okay. And then, of course, some people, unfortunately, they are mixed incontinence. They're both urgency and stress incontinence. So all in all, they have to do the, treatment. They will have to go through treatment plans like pelvic floor exercise and bladder training. Okay, for us, we treat the main complaint first. If it's urgency worse, we treat urgency first. Okay, stress incontinence worse, we may need to treat the stress incontinence first with either laser or surgery. Yep. And then, of course, we need to make sure that there's no pelvic organ prolapse. This is something that we have to understand. Sometimes after stress incontinence treatment, right, the patient get overactive bladder because it actually unmasks the problem for them. So for those patients with mixed incontinence, I do tell them the overactive part may get worse and they may need to continue medications. Okay. So overall, take-home message is incontinence itself is potentially curable. So we have a lot of medications and surgery to treat the different conditions depending on what the patients have. Okay, basically it does affect the patient's quality of life and should be treated. Good skincare is very important, especially for the elderly. And for those people who can't tell us, right, our elderly patients who are cognitively impaired or demented, right, we need to strongly suspect whether there's any overflow incontinence. Yep. So in all, right, when there is any form of incontinence, they should just bring it up to their primary physician or possible to see a specialist to see what we can do to make life a bit easier for everybody. I thank everybody for your time, and I hope you enjoy the rest of this TENA webinar. And any questions, right, you can go through TENA so that you can ask us. I'm happy to answer any questions later. Thank you very much.
Okay, one more time. Dr. Wu, thanks for the excellent presentation. I really have learned a lot. There are quite a few questions coming for you, so we're definitely going to take you up on your offer to answer all of them. Now, to enjoy some great TENA discounts and enjoy some free samples, please scan on the QR code coming up right on the top of my screen on the left-hand side, or click on the link in the chat box. And remember, this exclusive promotion is only available today and tomorrow. Now, let us welcome our next speaker. Our next speaker is Ms. So Wan Kim. She is the PR chairperson of Singapore Nutrition and Dietetics Association, and she's also the principal dietitian at Nutrimax Consultancy. Ms. So, you have the floor.
Nice introduction. My name is So Wan Kim and I'm a dietitian. Today's topic is on dietary management for healthy aging. I'll be touching on three main areas. We will elaborate later. Now let me ask you, what matters most when you reach old, when you are unwell and sick and you're not able to work? What would be most important to you? I have done this quick survey with some of my clients, and they say that it's the loss of dignity and the loss of independence, the loss of ability to buy their own food, to go out as and when they want, to choose what they want to eat, and even to shower, and even to be able to go to the toilet to urinate as and when they want, and not facing the fear of urinary incontinence, which is what is our today's topic on. So let us look at this case here. Madam Mary Lulu. Now this is a fictitious case, but I'm sure this is something that is familiar and it can actually happen in real life. Madam Lulu is 69 years old, weight is 42 kg, height is 155, the body mass index is 17, which means that she's underweight. She needs assistance when walking, slow sit to stand, requiring pushing up on armrests. The lab result is mostly unremarkable, no physical evidence of infection. But Madam Lulu is always looking for a toilet, and the doctor says she doesn't like the diaper and never wants to go out of the house. Now, surely you can agree with me, this is not the kind of healthy aging, nor the kind of quality of life that we want. Now, next, I want to share with you a question which I received. What sort of recommended diet that one should take care when we reach 50 years old and beyond to maintain a healthy lifestyle? I want to applaud the person who wrote this question because I'm very sure he is already starting to embrace healthy aging. But hang on there, we will come to this question later. But first, let's look at what is healthy aging and how it can impact our bladder system. The World Health Organization has defined healthy aging as a process of maintaining functional ability to enable well-being in older age. And dietary modifications has been shown to play an important role in healthy aging. Now, as we age, there will be an increase in age-related issues, and some of us may face issues with the lower urinary tract. Urinary incontinence, as Dr. Lim has pointed out, it is not a normal process of old age, but age-related disorders can make incontinence worse. So what are some risk factors that are faced by the older adults? As we get older, our muscle mass reduced, our skeletal muscle condition also reduced. From this study here, you can see that this diagram here, it shows us that on the average between 40 to 70 years old, there's an average of 8% drop in the muscle mass. Translated to overall well-being, you find that it can impact the bladder system, reducing contractility. It can also impact constipation, and constipation can make urinary incontinence more challenging. There's also a weakening of the pelvic muscles. Good nutrition has been identified to help improve aging. For example, it can build muscle mass, muscle strength, it can boost immunity, maintain healthy weight, manage chronic diseases, and so forth. The Academy on Nutrition and Dietetics have said that nutrition therapy is a crucial factor in promoting healthy aging and the quality of life. Next, I want to come to the question posed by one of our group here. Is any dietary considerations, food and drink, to keep our bladder healthy? This is exactly what we are going to discuss soon. Thank you for the question. So now we come to the three main areas that I would like to discuss. Of course, there are actually more than that, but I just picked three to highlight. First is on the protein as an essential nutrient. Second, consumption of dietary fiber. And third, the fluid and salt intake. Protein as an essential nutrient. Do you know that we need protein daily? An adequate amount of dietary protein has been recognized as a key modifying factor in muscle aging and physical decline. Skeletal muscle, improvement in skeletal muscle has been positively correlated to improvement in the immunity. And we know that improvement in muscle mass and muscle strength can help in balance, coordination, keeping us overall healthy and leading an active life. Now you may ask, should we take animal-based protein rather than plant-based? Is it that whenever we are short of protein, we must take meat? Now, animal-based protein offer us the complete essential amino acids. Amino acids is these molecules, the tiny components of protein, and they are not being able to be synthesized by the body. Hence, we need to take from the food sources. So, animal protein offer us the complete essential amino acids, and they have a higher bioavailability, meaning that it's highly digestible. However, animal protein comes with saturated fats and cholesterol. And more often than not, when we cook, we add salt and water, adding in more calories. What about plant-based protein? Plant-based protein offers something which animals' protein cannot give us, and that is the dietary fiber. So with the dietary fiber, it also helps us to increase in satiety, and we can manage our weight better if we are having excessive body weight issue. Plants also give us a lot of phytonutrients and polyphenols, and this provides us with a high amount of antioxidants, which is definitely good for us, keeping us boosting our immunity. Next, we come to dietary fiber. Do you know that fiber can actually reduce symptoms of continence? It improves healthy bowel movements. For example, if you look at the two main types of fiber, soluble fiber and insoluble fiber. Now, soluble fiber, as the name suggests, it is dissolvable in water, so it helps in digestion. And it improves the blood glucose level and also reduce cholesterol. The examples of soluble fiber are apple, oats, and barley. Insoluble fiber, on the other hand, is able to attract water into the stool, thereby soften the stool and ease the movement out of the body. Examples will be celery, nuts, and green beans. Improving the constipation can improve the urinary urgency. Why so? Because as we start to remove the bowels that's stuck in the body, we actually improve the body fluid movement and also reduces the strain on the bladder. How much is enough? How much is necessary, or rather, for our intake per day? The HPV's recommendation is 20 grams for women and 26 grams for men. Let's have a look at the National Health Survey report to get a feel of how much intake are we having for the fiber. Now, based on this National Health Survey done in 2010, it was reported that the dietary insufficiency of dietary fiber was 21.1%, meaning that the number of people who fell short of the dietary guideline by HPV was higher in 2010 as compared to 2004. For the fruits, it was again lower than 2004. It's 25.4% as compared to 29%. And for the vegetables, disparity was even higher by almost 10%. 2010 was only 31.2 as compared to 42.2, meaning that the Singapore residents are not having enough, particularly vegetables. So what could be a reason? It was found that a large number of Singapore residents are eating out. And we know that when we eat out, we tend to have an incomplete meal. So reflecting on the figures, can we just take a pause and consider and check through how much fiber are you taking a day? Are you taking enough? And if not, what can you do? And now let's look at the third and the final recommendation, and that is on the fluid and salt intake. As per consensus of the International Continence Society has endorsed fluid management as one of the essential in managing nocturia. Nocturia is frequent urination in the night. Three factors has been identified: high salt intake, caffeine intake, and fruits and vegetables. Meaning that high salt and caffeine can increase the frequent urination in the night. And on the other hand, if we can increase the appropriate type of fruits and vegetables, it can actually help to improve. So some of the food that we can consider looking at are listed here. Foremost is on fluid timing. Now, a lot of older adults, for fear of going to the toilet at night, which certainly pose a problem, a risk for falls and fractures, they will rather cut on their fluid intake. Coupled to this, their sensation of thirst has reduced because of age. One way that we can do is to time the fluid such that we take most of the fluid in the daytime up to like 3 o'clock, and then slowly tapering off to very minimal 1 to 2 hours before we sleep. Now, high salt intake has also been shown to impact the volume of urine. In a study done in 2017, it was found that older adults who took an average of 10.7 milligrams of salt as compared to a previous amount of 8 grams, the volume of urine in the night increased significantly. So it's important to avoid some of the food that has a high salt, for example, preserved and processed food. And also there's also hidden salt in things like sauces, soup, and gravy. So I will advise my clients not to avoid taking outside soup at night and to be mindful of the sauce that they are putting on their plate. The other thing that we consider is caffeine from coffee, black tea, and even cola. They can increase the diuretic effect. This can also happen in alcohol. We can also consider cutting down things like carbonated sugar drink, things like a number of citric fruits are acidic in content. All these can irritate the bladder system. Likewise, spicy food. So then what would be preferred choices? Fish and lean protein like chicken, green beans and barley, whole grains, nuts, and fruits like banana, pear, apple, and potato. So if possible, try to plan your diet, especially for the night, along this line. What about lifestyle modifications for bladder control? So briefly, I have listed out some of the key factors like pelvic floor muscle. It's important to strengthen your pelvic muscle. The recommended is the casual exercise, and then to time your voiding such that try to empty your bladder before you sleep, train your habit, to retrain your habit, bladder training also, and to have an active physical activity lifestyle, and also to quit smoking. So now I come to the last slide, which is on the summary of the whole, the short session which I have with you, and that is that good nutrition is essential in healthy aging and quality of life. Aging increases the risk of bladder control issues. It is crucial to adopt a well-balanced diet and lifestyle modifications that are suitable for you. Now, don't feel disappointed that you'll be limiting your choices of food. Not quite that way, because some food that may be identified as irritants may not necessarily be applicable in your case. So you might want to test it out. For cases that you may be craving for some food, like for example, spicy food, perhaps you can allow yourself a little bit on good days and making sure that you don't have too many potentially irritating irritants in your diet for that day. The bottom line is a personalized nutrition. And that personalized nutrition can include dietary protein, dietary fiber, fluid intake, and low salt in your management of urinary incontinence, and thereby to optimize health. Now, my last takeaway message is that there is no one-size-fits-all diet plan. Taking small, realistic, and practical steps of changes that can work well for you can contribute to healthy aging. Now, a doctor may refer you to a dietitian, and you may be wondering what dietitian can do for you. I have listed some of the factors here. In view of time, I just want to highlight something. Dietitians can personalize a meal plan for you that can fit your nutritional requirement at the same time that can fit your lifestyle. We also help you to monitor what food may affect your condition and work towards a better nutritional status. Okay, let me end this slide by showing you this is where I work. Okay, now I'll stop sharing and answer some of the questions that was being raised. The first question was, what diet should we take when we reach 50 years and above? One of the things that would be useful would be protein. You can make sure that you have enough protein, and take a look at what kind of protein are you taking. Is it animal-based or plant-based? Are they giving you extra calories? How are they cooked actually will also be crucial. You may also want to look at your fiber. Taking complex carbohydrates would be a much preferred choice compared to simple carbohydrates that give you high sugar content and low or zero fiber. You may want to also look at other factors that build up your muscle mass, muscle strength. You may also want to look at your bone health, making sure that you have enough calcium and vitamin D. At the same time, maintaining a healthy physical activity lifestyle is also important. So check in on how much exercises you are doing. Do you have a minimum of 150 minutes of moderate exercises a week? And what about your weight? Are you within the healthy weight range? If you are underweight, there is a risk of nutritional deficiency and a risk of osteoporosis. If your weight is in excess, then you may want to work on it to reduce the risk of chronic diseases. Now, question 2 was any dietary considerations, food and drink, to keep our bladder healthy? I have already discussed during this session. And the last question is, does being fat is a cause of concern? Absolutely, it does. Excessive body weight is a risk of chronic diseases and affect the performance of kidney and bladder, leading to continence issues. However, if the person is slightly overweight, it may not necessarily be that that is at a high health risk. You might want to also look at the body fat content. But on the whole, if you are assuming that a person is having obesity, then that might lead to worsening of your incontinence issues. Now, some studies have suggested that excess body weight, and we are talking about a more significant amount, it may increase your abdominal pressure. And this, in turn, can increase your bladder pressure and mobility of the ureter. This can lead to stress urinary incontinence and may also cause an overactive bladder. So, okay, I have come to the end of this session. It has been such a pleasurable time, and thank you for your attendance again. And I think it's not too early to wish you Merry Christmas and a healthy 2022. Thank you.
Thanks, Miss So. I was actually going to wish everyone happy holiday season and a great happy new year. But anyway, Miss So, thanks for your invaluable insights and advice, and also for taking the opportunity to answer all of the registration pre-questions. There are quite a few more questions for you which are coming up later on, and I will be asking them on your behalf. So now let us take the opportunity to welcome our next speaker. Our next speaker is Mr. Wilfred Tay. Mr. Wilfred Tay is a Financial Services Director at Strive Makers Group. Hi, Mr. Wilfred. The floor is yours, Wilfred.
Hello, hi, good afternoon, everyone. Good afternoon, ladies and gentlemen. It's really great to have this session, and I hope that I'm not standing in between your lunch. I hope before the session started, you were actually preparing your lunch already. But it was a great moment to actually understand a few areas, especially coming from Dr. Lim, Dr. Wu, and also Miso earlier on. It was very, very relevant to us. Well, of course, my role today is not about the elaboration too much on the incontinence, because I believe they have shared quite a few important things. But of course, being in the financial consulting business, more importantly, the main idea of my discussion is all about money and wealth. So I hope that in the next few couple of minutes, it will be fantastic that I will have this opportunity to share with you guys. And if you do have any questions after that, just let me know. All right. Okay, give me a moment. Let me share with you the slide. Can you guys see my slide right now?
No, not yet.
Not
yet, Wilfred.
Okay.
Yeah, not yet. I haven't quite seen it yet.
Okay.
Because you're clicking, need some.
Okay, give me a moment.
You've got to click on the share screen button. It's a little square with a plus sign in the stream feature. So if you look to the bottom of your screen one more time, on the bottom row, there's a function which has a computer screen and a plus sign inside, and you can click on share.
Okay, sure.
Got that?
Yeah, I got that.
Okay, no problems. Charlene, are you able to share it, Charlene? Then what we can do is we can do an override, and then we'll pass on the PowerPoint to you.
Just give me a second.
Okay. Okay, please give us a minute or two while we work out our technical difficulties. Wilfred, you wanna let me see, what can we do?
Share.
Okay, how about I go to I'll get Charlene, our production end, to share a PDF. So Charlene, could you please download PDF version and do a share and see how we go from there? Okay, it's loading now. Can you bring up? Okay, it's processing. Okay, there we go. Okay, I'm gonna exit. Wilfred, the floor is yours.
Thank you. Sorry for the momentary break. Okay, cool. Let's go. All right. So basically, right, this is just a background about me. I've been in this business for almost more than 10 years already. Most of the time, I've been speaking to many different fantastic individuals, reputable, appointment holders as well, ranging from SME to MSCs along the years of business. And I work with a couple of many different positions and also different industries. So I hope that through my experience today, I'll be able to navigate more about what you need to know in the areas of protecting your wealth, of course, with relevance to the incontinence as our main discussion. All right. All right, so I think previously, I think we do have some information and statistics about the urinary continence. So just to give you all a better clarity as well, as of just some research that we have done, at this moment, we do understand that in Singapore, particularly in Singapore, because this is a very universal, issues and problem across the world. But as far as Singapore is concerned, we notice that there's a good around 15% of the women that suffer from stress from the urinary incontinence. So this number actually has been rising along the years, and I think previously, Dr. Lim and Dr. Wu do have highlighted a few areas as well. So it has been a rising trend. It has become a concern to most of us. But we notice that these are the areas and information that we need to digest. But the next question is, what are the things that we need to look out for as well? So at the same time, if we take a look at this interesting information for the ladies, especially people who are above 45 years old, we also see a very staggering statistic that 1 in 3 women actually also are affected by stress urinary incontinence. So that is something that we're pretty concerned for many different doctors and medical practitioners. But of course, we all know that there are always areas that we can do something to improvise and to actually improve our current lifestyle, or in terms of diet wise, as what Ms. So has mentioned earlier on. This actually plays a huge part in decreasing the probability of stress urinary incontinence. But the next question is, how about the guys? All right, so you can see here, this is not just a female problem. It can happen to the men as well. In fact, all right, if I were to look at a broader condition called the bladder control, actually, in fact, more than 43 million of the men around the world do have this issue as well. So interestingly enough, this is quite alarming numbers, for us to take note. Long story short, you can see that this whole discussion is not just about the ladies, but it also matters to the guys as well, because to a specific gender, of course, you'll be narrowed down to a different types of subtypes of conditions, but eventually it applies to both men and women. So now the next question is, as we move further, a lot of people have actually asked us, hey, Wilfred, today if I have this condition, does it affect whether I can enroll into insurance policy or not? All right, so we got this a lot. So maybe if I can share with you on the next slide. All right, so a lot of you guys probably may have this question coming into your head at this moment. So this is a very common question. All right, if you do have this question that cross your mind, it's perfectly normal. We do have this, quite a frequent encounter. So the first question is, of course, insurers such as the underwriters, the actuaries, who are the back ends, who are the planning department, who actually design the policy and the coverage as well as the premiums. They will take a look very closely in terms of the medical condition of the individual. All right, so they will look at whether this person diagnosed with what kind of condition. First of all, if I were to give you all some idea, they will break down into 2 different categories. Whether is it chronic or non-chronic. All right, so if it's a chronic condition, to put it in a very layman way, it means that these conditions are very unlikely to go away, even after it has been probably treated. All right, so for instance, if I were to name one example, would be diabetes. Diabetes is a chronic condition, right? Whereas on the other side, we're talking about non-chronic conditions. So what happened was when they look at these 2 different conditions, they will be observing, what are the areas, that requires ongoing treatment. So if you ask me, it really depends on the conditions, and of course whether any more follow-up treatment required, any surgery. So my statement to all of you here is that in the event, if let's say there's no more ongoing treatment and then no medications required, very highly likely the enrollment of the policy will be high. All right, so that's one interesting fact for you. Okay, now the next question. So some of you probably may also have this idea. Hey, Wilfred, how about if I have made a claim before, does it matter or when I purchase a policy in the future? Once again, you really also see it's not about a claim, all right, per se. It's more about the driving factor that resulted in this claim, which is the condition. All right. So once we take a look at the condition, it could be probably an injury, or it could be due to the internal condition. So all this actually plays a part. Or whether is it difficult or not, don't worry. Ultimately, we do have underwriting checklists, for you to cross-reference. So you don't have to be too worried or too puzzled in, would that actually affect, in my policy purchase. Don't worry, leave the task to the experts, which is the underwriters, to do so. And once they assess, it will be done. All right. So no worries. Later on in the Q&A session, we will be able to get more. Okay, cool. So the next question is today, insurance policy, most of the time you notice is always about after something happened, then we pay, right? Yeah, so this is how insurance policy are being designed. I would say that yes, most of the time is meant to actually pay out certain lump sum, certain sum assured to the beneficiary, right? But the next question is actually a lot of times, right? We can also look into how we can prevent it first. Before it happens. And of course, today in my line of work, of course, I'm not the medical practitioner. My role is more towards providing you that kind of financial capacity, for you to actually get yourself in check. So one main feature that we do have in the insurance policy is that we do have this policy that actually send you for complimentary medical screening every 2 years. Right, so this will allow you to have a better clarity about where you stand right now in terms of medical condition. And I strongly believe that when you have clarity, you will have certainty. Right, so these two C's come hand in hand. Now, so the next question is, okay, what kind of medical screening that I will be able to enjoy? So the good news is, we do have those ECG, cancer tumor marker, your basic FME for full medical examination. All these will be inclusive, all right, in our insurance policy to ensure that every 2 years I will be able to enjoy that, to get all these complimentary health screening done, and then from there I'll be able to see, oh, so this is my current health status. Then you can do a reference check, or probably you have do some reflection. Should I do something, by adjusting my lifestyle, adjusting my diet? So all this can be done. All right, cool. So this is one way. It can be adopted before things happen. But of course, nevertheless, I will have to touch on the part whereby if something happens, then what's next? Cool. So that will be on my next slide. Right. So the interesting enough is that a lot of people actually have this question. Wilfred, today I already have medical insurance already. Is there really a need for this thing called the critical illnesses plan? All right. Okay, so first of all, right, I would say that these two programs are very unique and they work very differently. But there's a myth that people may misinterpret that these two are the same. All right, but don't worry, I'll run through with you in a very quick way to let you have a better understanding. Okay, so first of all, medical insurance, right, is actually insurance coverage that take a look at your medical expenses. Okay, so you might want to write this down. Medical insurance only look at your medical expenses. They don't look at any other things, right? Only look at medical expenses. Critical illness coverage only look at your diagnosis. All right, so you can see the difference. Medical insurance only look at your medical expenses. Critical illness only look at your diagnosis. So critical illness plan don't need to care how much you pay for your medical bill. We look at the doctor's diagnosis. We vet through. Everything is within our guidelines, within our definition, which under the Life Insurance Association, and then we pay out. Yeah, it goes like that. Yeah, so that is one area that a lot of people may be confused with. But don't worry, on the next slide, I'll give you some clarity about how does critical illnesses runs as well. Yeah, so you can see here, critical illnesses in Singapore is actually also in a very alarming rate. Yeah, in fact, you can see that the number of people diagnosed with a medical condition is relatively high. So the next question is, what kind of condition is there? But most importantly, I want to bring attention to the most right-hand side of your screen. If you notice, the reason why there is such a strong need for critical illnesses at this moment is because medical insurance does not cover all these items on your right. So if I were to name a few, things like your household bills and utilities. So what happens is that when a person actually falls sick, fall ill, right? Most of the time he may have to actually, take a break from his job. To the extent that, after he clears his annual leave, he has to activate his, unpaid leave. Yeah, so end up, he has to actually be self-sustainable in terms of the expenses. Yeah, and then of course, things like your groceries, your essentials, your mortgages also have to be paid, right? Even though the person not working. And then of course, most importantly, through this particular session, for our adult diapers, TENA diapers, for example, are not being covered by medical insurance. Yeah, because it is not classified as a medical expenses. So today, when you have a critical illness coverage, yes, this will help a lot in terms of your sustaining of your lifestyle if the person is being diagnosed with a condition. Yeah, so this is a very, very important information that a lot of people are not aware. They thought that, oh, medical insurance do cover all whatever I need to. Yes, to the medical expenses aspect, but not in terms of other aspects that you need to sustain upon after you discharge. Things like you need to hire helper, hire maid, all these money, right, that you need to actually pay for it. You can't work, or there's no income. All right, that's why critical illnesses will come in. All right. So more importantly, right, these are the areas of concern. All right. So the next question is right now, there's very interesting fact is that our program, normally don't just cover one occurrence or condition, because a lot of people may feel that does it cover this way. So on my next slide, you can see that right now we have a one and only unique program in the market, whereby a lot of times people have this saying, if I claim insurance already, means that I cannot buy anymore and the plan will terminate, right? Yes, for majority of policy, it works that way. And of course, the whole industry actually also understand the concern, but what if the person actually, after he make a claim, the policy terminate, but what if there's a relapse? Or what if, there is actually, other conditions that occur besides probably the first condition? For example, we have seen people who diagnosed, with first of all cancer and eventually, stroke as well. So it's two different types of conditions. So typically, if the person diagnosed with one already and he made a claim, the policy will terminate, end of story. And I would say that it's very unlikely he can buy insurance again. So the good news is right now we do have a program which is called a Proactive Protect. This will allow our clients to actually claim not more than 5 times, but at least more than 1 time of the different reoccurrence. So there's some people who actually share with us, is it really such a situation where the person have 5 different conditions? Personally, I hope that this doesn't happen in many different people. But we did see claims like that, people who are actually diagnosed with one condition. Few years down the road, they are being diagnosed with another. But anyway, my main idea here is that it's very, very important to actually review your current portfolio. I'm sure that most of you here do have your certain policies already, which is fantastic. But along the way, insurance policies are like our phones. We need to update, we need to upgrade as well to ensure that we have the up-to-date coverage and benefits. So it is very, very crucial for you to actually run a review with your consultants, or even let's say if you have an opportunity to work together to speak with us, me and my specialist team as well. That will be fantastic. So this will be something for you guys to actually learn from it, and we hope that this is something that you can revisit very, very soon after, especially right now when we do have a few areas of concerns that you may have. Yeah. So long story short, do ensure that you get yourself adequately covered. So I believe I have explained very clearly between the difference between medical insurance and critical illnesses plan, and we notice that most people do not have sufficient critical illnesses coverage. So that is something for us to look for. All right. If not, that's all for my session, and I shall hand it over to Terence.
Thanks, Wilfred. You recovered extremely well under very difficult technical considerations.
Thanks.
Okay, great. So now let's welcome back all of our speakers. Ms. So, Dr. Fiona, Dr. Lim, Welcome back. Dr. Lin, you did the shortest of all of the talking, You did the very great opening and you left it to the rest of your colleagues to do all the hard yards. No, just joking.
Yes.
Dr.
But
Lin.
I must thank Dr. Wu and Miss So for your wonderful talks. I must admit that, of course, being in the field of medicine, I understood half of what Dr. Wu was talking about, but she's a urologist. She's a specialist dealing with the bladder. I deal with the other outlet. So I learned a lot from that talk. And it was very good to hear from Miss So about healthy aging. My quick take on her slides was that the most important point I learned was make small, realistic, and practical steps in changes to your diet. Don't suddenly change, because when they are small and realistic, it is something that we can continue doing, sustainable changes. Because to me, when I eat, the most important thing is what is the aim of eating, and that is to have happiness without the harm. And of course, lastly, the nutrition. Would you say that, Miss So?
I think most definitely. I think Miss So, I can see her nodding away. Thanks, Dr. Lin. Actually, on that note, I want to maybe ask a question from Miss O, because I've looked down a whole bunch of questions, and actually a lot of them have got to do with types of food. My favorite food is char kway teow. I've got another person asking, why rice? Should I cut down? Is coconut milk okay? And what foods should I actually avoid, and what foods should I take? So, Miss So, if you could just maybe go through some of those thoughts again. Okay, I think you're on mute, so you might have to unmute yourself a bit.
Yeah. Can you hear
Okay,
me?
we can hear you now. Maybe just a little bit louder.
Okay, can you hear me? Okay, I try to speak louder. Okay.
That's
Hi,
fantastic.
yeah. So I was just saying that your one question has many questions. So I will start with the favorite one, the char kway teow, since I think it's top on the list of many people. So can you eat char kway teow? My take to you, first of all, is if I say no, will you stop? No, right? So then what can we do? We go on modification. Okay, if you really like char kway teow, there are some strategies on it. You can share with people. But above all is that if you understand what this food is, what this dish contains, it may put you in a better position to change or not to change what you eat. So if we know that char kway teow behind it, first of all, the kway teow is a processed noodle. Now we know that taking fresh food is definitely a better choice. Okay, if you want to take processed food, okay, because it's a cultural thing, then can we add in whole grains so that we can add in a little bit more of dietary fiber? 2, okay, char kway teow cannot be fried char kway teow, cannot be fried char kway teow if there's no oil inside. So would we be able to change the oil that's been cooked? Fair enough, if you eat outside, you cannot tell the person, hey, I want to have olive oil or canola oil, right? So there is then a choice. Do you want to eat a healthier fried char kway teow? Then maybe you can do a little bit of your own home cooking. But if you say that, no, I don't know how to cook, then okay, we have to live with that decision. Then perhaps you can ask the hawker. I'm assuming that you go to a hawker center, since in Singapore, it is a much cheaper and easily available source of food for us. Then you may want to tell the person, Uncle, can you reduce the oil that you're using? Then, okay, how about the bean sprout? Some of us, we eat fried char kway teow. We don't just eat fried char kway teow. We told the uncle, don't want tauge, don't want bean sprout. Put in more ham. For some of us who don't know, ham means clams, right? The cockles. So can we do some little change here? Tell the uncle, can we have less kway teow and put in more bean sprouts? And then don't want the cockles. And then
Got
you
that.
can tell the uncle
Understand.
too, can we cut down
Okay.
a little bit on the dark sauce? And then
Okay,
when
got
you're
that.
finishing, don't sprinkle the oil. Okay, so that's my take.
Okay, fantastic. Dr. Fiona, I got so many questions here. Maybe if I can try and summarize one question. We've got an issue about frequency of going to the toilet, many bathroom breaks. Is this a symptom of something more sinister in terms of a health condition?
Can you hear me?
Yes, we can. Loud and
Okay.
clear.
Okay, good. So basically, I think it depends on how much water the person drinks as well. You look at question 1, right? What's the recommended healthy time to visit the toilet when one feels a little urge? It depends on how much water. For example, if they just drink a big glass of water, right? Sometimes within the next 15 minutes to 30 minutes, they will need to go toilet. So I think that's quite normal. If I drink a lot of water, I'm sure I would, the same thing happens. But the thing is that if you don't drink water, you consciously, right, stop, dehydrate yourself, right, and you keep needing to go toilet, then there is a problem. So sometimes when patient ask me, I was like, oh, how much water you drink? That kind of thing. So it makes sense if they drink water and they need to go urgently. But of course, if they don't drink water, they drink there are people who drink only 2-3 glasses of water per day. And they keep wanting to go toilet, like every hour they go for 15-30 minutes, then there's some issues. That one needs treatment. Then I will teach them they need to do some bladder training, drink more water and go toilet regularly. So basically it's to build the capacity so that they can hold longer before they go for the next toilet break.
I see.
And also depends on what they drink. In general, I ask people to stop caffeine or reduce caffeine, because there's a lot of urge associated with caffeine. It's not only caffeine, it's Red Bull, bubble tea, green tea, Chinese tea, all the tea. Okay, those have problems, I feel.
Okay, understand.
Then,
let me see.
yes, Evan.
Keep going if you like. Yep.
Okay, so what are the ways to maintain a healthy bladder? So basically, I think general for all both males and females, right? We just need to drink water. Okay, Singapore is very hot as a ballpark figure, I tell them to drink 1.5 to 2 liters. If you can go up to 2.5, I think that's quite good. But anything beyond 3 liters, I think is a bit too much already. If I drink 3 liters, right, probably will need to go toilet every 30 minutes to have 1 hour, especially in our air-conditioned places. So I think that's one way of maintaining health. And then go toilet regularly. Okay, every 2 to 3 hours, you should go toilet and clear your bladder. Don't hold back. Because there's a group of people who hold back their bladder so much, right, when they were younger, till the bladder distension is so bad, right? When they become older, somehow the elasticity is not so good. So as time goes by, they find it very hard to void out to completion. So that itself is another problem altogether. So the bladder is overstretched. I explained to them our bladder is like a rubber band. If you're going to overstretch it, right, it's not going to go back to its normal size. So that has a lot of
Understand.
problems, especially when they're old.
Understand.
And then
But
there's- Yes.
Go ahead, please. Go ahead.
No problem. You can ask your question.
No, because I just want to continue on from what you've just said, because I still keep getting questions about I'm walking, jogging for long periods, approximately 30 minutes. Sometimes I have an uncontrollable urge to pee and there's no toilet. Is this a sign of incontinence or is it a prostate issue?
It depends on whether it's a male or female. If it's a male, it may be a prostate issue, but most of the time it's a bit of overactive bladder. Overactive bladder affects everybody. Like I say, it can be old, it can be young, it can be male or female. So if they jog, right, and they find this urge, right, that's very uncontrollable, there is probably some issue. Of course, it depends. If they just drink one kopi o, gosong, right, and they go and run, right, obviously they'll have a bit of issue. So I tell patients, though, if you're going to do activities like take a long bus ride, train ride, go jogging, or go traveling overseas, you're on the tour bus, please don't take all this caffeine. It's going to make your life a bit painful. Yeah.
Understand.
But
That's
when
very
they
good advice.
want to
If I may-
sweating, yeah.
If I may
Please, Dr.
comment
Lim.
a little bit at this time.
Yes.
So I think a lot of the questions are related to things that are a little, I must admit, from the questions, they are a little unusual for people to experience such things. But it is very useful for you to look at yourself and see a lot of what we talk about a healthy bladder has to do with a good lifestyle, with a good diet, right? Avoiding things that will irritate our gut and bladder, so such as a lot of sweet stuff, a lot of caffeine, chemicals that are not what our body was used to having, say, in 50 or 100 years ago. And these chemicals have come into our foods today because they're processed, they're easy to get. But because we take these things like caffeine, it can irritate our body. Having a good diet, being physically active helps. But if you find that you are not able to do the activities that you used to be able to do in a simple manner,
Understand.
say, for example, you're jogging and now I have to run to the toilet, please just speak to your doctor and find out maybe there is something a little bit more. It may be nothing, but it's always good to speak to your doctor first.
That's great advice. Thanks, Dr. Lim. I've got two questions here for Wilfred. Let me see if I can try and make sense because they're not in the exact sentence. As a sandwich generation with elderly parents facing incontinence issue, and I have a young family. In terms of insurance, is there any sort of advice you have for me?
All right. Okay. So just to understand, this individual has an elderly, all right, and also have kids, right? So it's in the middle generation.
He's in the middle. He's got older people. He's got younger family.
All right. So the advice is how he can manage his finances or finances.
Maybe he just wants it's not said here, but maybe just some general thoughts on his insurance strategy.
Okay, cool. All right. So I hear you. I think this is quite a common situation at this moment in the current era. All right. So I think the first question is, we have to look at our parents, their age, and of course, what is their current profile? Are they still working or retired already? That's first question. Second question would be we look at what is the insurance policy that they currently have. But most importantly, I always want to highlight to a lot of us here is that for the elderly one, the first priority is always medical insurance, first one, because that's going to be the more relevant, and I would say that the higher occurrence of claiming is also very high. I mean, take a look in the hospitals today. We tend to see more of the elderly or the younger one, right? We can easily observe. So it's very, very crucial to ensure that the elderly do have a medical insurance in place, right? That is the first one. All right, and then secondly, in terms of being in the sandwich generation, of course, you also need to ensure that your dependents, which is your kids, will have good clarity in their future. So we should also need to ensure that while they are actually right now studying or while they are navigating their education journey, we're going to ensure that these expenses for the educations will not be disrupted because of anything happens to the breadwinner or to the parents. So we need to ensure that there is an income replacement program that allows you to have a peace of mind. So while your kids are studying, working their way up, to their primary school, secondary school, or in the future university, right? It is going to be a long journey. You have to ensure that the good next 10 to 20 years will not be disrupted because something happens to the breadwinner. So more importantly is if you have these two in place, that should be your highest priority. So let me conclude for you. The first one, ensure that your elderly, your parents have medical insurance in place already. All right, that's number one. Number two, ensure that your dependents, while relying on you to actually build their education journey, if anything happens to you as a breadwinner, it shouldn't disrupt their education journey.
Okay,
right.
Thanks for that, Wilfred. I've got next question for Dr. Fiona. Coming back to Dr. Fiona, because we're talking about treatments. The question is about laser treatment. Is it painful? Will it break the hymen? If I have an injection to the bladder, will it hurt? Will it break the hymen as well? And maybe if I can bring it round, what is the cost for incontinence treatment? So I put a few questions together.
Okay, I think there's a little bit of, can you hear me?
Yes, we can. Loud and clear. Fantastic.
Okay, so I think everybody got a bit confused. Stress incontinence treatment is a bit different from overactive bladder. So we start with stress incontinence. The laser treatment, right, you just feel a little bit of warmth, like I said just now, inside the vagina when the laser is moving in and out, but there won't be overt pain. Okay, and the fact of the matter is usually I think the person asking the question, will the hymen be torn? As it goes through the vagina, if the hymen is still there, then yes, it's going to be torn. But to put it into look at it from a different point of view, right? Usually, right, the people who have not have intercourse before, right, the risk of them of having incontinence, stress incontinence is not high. Because for most females, right, stress incontinence usually comes after delivery. So if there's no delivery, there's unlikely, right, chance that they will need this kind of treatment lah. That's one. Okay. Then for overactive bladder, right, Botox injection, right, we put in a scope. Okay, the scope is a bit uncomfortable. When the needle pokes into the bladder, if the patient is awake during local anesthesia, then yes, there'll be some discomfort. But fortunately, most patients are very good. They can tolerate the discomfort. It's not too bad. And then the
Cost.
treatment, the cost as in the
Cost.
causes
Okay.
or the COST cost.
COST, I think it's a money question.
Okay. If it's a financial question, right, it depends on where it's done. And in the restructured hospital, right, usually for Botox injection, out of pocket, right, I think the patients pay a few $100s. I don't think that it's going to exceed more than 500. For the laser treatment, so far, right, as far as I know, right, I think NUH has it, KK is running a trial, and maybe Changi Hospital has it. So basically, it depends on individual hospital charges. For us, right, again, we don't charge patient more than less than should be anything less than $500 for subsidized patients. For private patients, right, I think it went up to 2,000 to 3,000 for 2 sessions.
And you could obviously use your MediSave and your MediShield to cover a large chunk of those costs. Otherwise, presumably, health insurance would cover some of that. Wilfred, is that a yes or?
Yes, of course. We look at the diagnosis of the doctor. If the diagnosis of the doctor is indicated as medically necessary, of course, it will be within coverage.
Okay, that's fantastic. So that's reducing out-of-pocket expenses. I've got a question for Ms. So now. I have an elderly parent, or I'm elderly, and I'm recovering, and they are recovering from UTI. What is a recommended diet?
Okay, for UTI, some of us may not know it's a urinary tract infection. The good thing is that this need not be permanent, so it can be a temporary situation. And more often than not, it could be due to infection. So what we can do for most is to build up our immunity. So things like vegetables and fruits will be very helpful because they are rich in vitamin C and antioxidant. The other thing is that we will want to make sure that the food that we are eating are clean. So food safety becomes very important. So make sure that the food you're taking is well cooked. And if you are taking raw salad, you may want to be a bit more conscious there. If you really have to eat the salad, like some of my patients do, then it's best for you to really clean them yourself and make sure that you buy from people that are reputable. So other things is like make sure that you have enough calories, enough proteins, and have a good rest well, because, and if possible, when you have better, maybe you want to go out and have some sunshine, as vitamin D is helpful. Okay, I think I will pass back to Terence. I think time is a bit short here.
Okay, time is indeed short. We're running short. We need to end in a minute or so. I'm going to let Dr. Fiona, take the last question. And then I'd like Dr. Lim to do a quick summary, if that's okay. Yeah, so Dr. Lim. So the last question for today is, my special needs girl, who's 11 years old, has a tendency to wet her underwear more often on rainy days. She doesn't believe she drinks too much. Is this normal? Should I put a pad or a diaper, and maybe some of your advice for me?
Okay, so for this is a special group of patients that we see, especially when they're a bit young, they cannot understand. So it depends on, they don't drink a lot of water, but they need to go toilet regularly at a regular interval. So I think it helps, right? If you ask this patient, right, to actually go to toilet regularly, maybe you will do some potty for her, right? What we call potting is a medical term, right, where we actually bring these patients to the toilet and ask them to void. It's like toilet training for young children. We ask them to go to the loo, right, every 2 hours and try to pee out everything. Otherwise, in between, if they hold a while, sometimes, right, the urgency comes and they just wet themselves. So I think it helps in that sense, you see. And then, of course, the fluid they drink also important. Like I say, if they drink, there are a lot of insensible fluid intake on, like soup, all this. So I think as a parent, we just have to monitor the amount of fluid they take and what kind of fluid. Don't take too much caffeine also like, as well. Oh, and then nowadays all the bubble tea, all these are a bit bad. So avoid that. Okay, I think regular toileting is very important for them, even for the elderly. It's the same group of patients, I feel.
Okay.
And
Thanks,
sorry,
Dr.
Evans,
Fiona.
one more comment. To add
Please.
in, right, just now Miss So's question, right, about the UTI patients. We see quite a lot of UTI patients in urology. I think diet-wise, right, I think the most important thing, other than healthy diet, right, is to drink enough water. A lot of these elderly patients are actually on medications to pass water for whatever heart failure or kidney failure, right? They are on medications, so they tend to pee out a lot of water. So, then their intake may not be adequate lah. That's what I'm trying to say. So ask them to drink a little bit more water if their health permits, and then go toilet regularly. These are for the UTI patients. And then try to avoid certain agitating factors, like the food that irritates their bladder and bowel. Sometimes spicy food, sometimes sour food, right, will give them problem as well. So after acute episode of UTI, right, we should avoid this kind of food. I don't get constipation. Dr. Lim would say, don't get constipation. Because a lot of all these elderly, especially males, right, get constipation, then they get retention of urine or UTI. So try to avoid that.
And
Yep.
and
Okay.
diapers, is that something you would encourage as well? Because obviously, if you for some patients,
So for me, it's very simple. If the patient really needs it, they need to have it, especially those who are cognitively impaired lah. In other words, they have a bit of dementia. You need to have diapers and pads, but we should always change it when it's wet. Otherwise, they'll get bed sores and skin issues. That's one. Another thing is the cost. Then you end up paying a lot of money. So what we can do again is to go for regular potting for these elderly patients. Ask them to go toilet regularly so that they empty quickly and don't keep don't keep peeing inside the diapers. And then ask their helpers, right, to check on them regularly and change if required. Actually, our aim, right, to stop incontinence is to stop them from using diapers and pads as far as possible, especially those people who are relatively young, in the middle age, right, or I would say below 70, right. We try not to let them use the pads, because other than cost, right, it's also skin issues. So we'll, try to treat them so that they don't need it. Yeah.
noted. Thanks, Dr.
Okay, Darren, thank you.
Fiona. Dr. Lim, closing comments, please.
Okay, thank you, Terence. First of all, I want to thank once again ESG for hosting this webinar. I want to thank Dr. Fiona Wu, Ms. So, and Wilfred for sharing today on 3 different aspects about how we can stay healthy and about our bladder health. I also want to thank actually our main sponsor, TENA. While Ms. Wu just finished by talking about how we want to avoid diapers, it is absolutely true. And TENA, even though they are the largest diaper provider in the world, they have been very supportive of the efforts that we have put in to actively encourage and train and educate people about maintaining their bladder health in order to avoid being dependent on diapers. And I think that is a fantastic effort from a company that deals with these products. I want to say to all the attendees today, thank you for coming in. And I hope that you had learned a lot. My take, when you summarize all 3 speeches, all 3 talks, is that we have to take an active effort to look after our own health. We look after our own health by ensuring that we stay hydrated, we drink lots of water, and water is better than Coca-Cola or any bubble tea, right? Number 2, we need to ensure we have a very good diet. If we think that we need to make changes, don't fret about it. Make small, practical steps. Change gradually so that you can find the right answer for yourself. If you do not know what to do, speak to a dietitian or a nutritionist to find out more. If you have a bladder problem, speak to a doctor first. If you're not sure whether you are having the right kind of coverage, because medical treatment does cost money, speak to your financial advisor, speak to your agents, and find out how should we protect ourselves, how should we protect our loved ones from sudden, unexpected medical bills. all right? Because we want peace of mind, we want happiness in life. Ultimately, everybody needs to stay healthy and happy. You cannot choose one or the other. You must have both. It's a marriage, right? Happy and healthy. Okay. And with that, I thank you all.
Thanks, Dr. Lim. So I think that's all the time we have for today. Once again, to enjoy some great TENA discounts and some free samples, simply scan the QR code or click on the link in the chat box for more details. And remember, this fantastic promotion is only available today and tomorrow. But on your way out, please take the minute to fill in our survey, as your feedback is really important to us. And remember, Singapore residents who complete the survey can stand a chance to win great prizes in a TENA lucky draw. Kindly follow TENA Singapore Facebook page to find out the winners of the lucky draw and other great promotions. Now, to all our fantastic speakers this afternoon, a very big thank you from all of us here. You've certainly transferred a wealth of information to us. To all our participants here this afternoon, thank you for joining us, and all the very best for the holiday season, and see you again in 2022. Thank you and goodbye, everyone.
Thank you.
Hello， 你们大家好，我是丹秀春，我是天天要穿那个尿布的安迪，流动差不多7年以前了哦。每次紧张了就特当的紧张，然后跌到这边，跌到这边，那个哈，这个手肿到这样了，马上呢哦，就叫 MC 人来了 ，MC 人来了就一起当国星。我有心臟病，我有血壓高，我有膽固醇，我還有甜尿，甜尿剛剛來。他們只想讓我用這7年走一路哦，我喜歡呢。我跑到哪裡，他們跑來跑去。哦，這邊除非這邊有個人要包一半是要出去哦，我也是送人家一邊去包的，不要緊啦。啊，这个需要用就用，未排泄。这个人需要用就用，这个更卫生啊，更清洁嘞。希望每个人需要用那个棉被的都要用。你不要说省了不要用嘞，我们老了尿很臭的，一定要用的。
Hello, my name is Yuan Ki. This is my mother. She's 89 years old. 7 years ago, she met with a car accident and she has to stay in the hospital for 6 months. So after her recovery, she became incontinence and she has to wear diapers in order to maintain her lifestyle so that she can move about. And we actually tried a number of diapers. Eventually, we settled on TENA because we find that it provides the best value for money, and it provides her also comfort and also keep her dry, and she's able to maintain her lifestyle. And I'm happy that despite my busy working schedule, I'm glad that I'm able to give her the best quality of life.
Hello everyone, my name is Melanie. I am the nursing manager of Peace Haven Vidok Day Center. Peace Haven Vidok Day Center is under the umbrella of Peace Haven Nursing Home. We have services like residential, which is our nursing home, and also non-residential, which is our day center. Currently, we have 4 day centers, each region of Singapore. We have programs like dementia daycare, maintenance daycare, and IHDC or Integrated Home and Day Center. Currently, I am in charge of Integrated Home and Day Center. Integrated Home and Day Center, we have currently 60 clients serving in the East. We have clients with different or multiple medical conditions that requires assistance. Most of them attend 6 days, and we provide meal service We provide showering service and also changing of diaper. Because of their conditions, many of them requires assistance and family member is having difficulty taking care of them. In order to provide better bladder management, we recommended our clients to wear disposable pants. It will make it easier for our staff, for the caregiver, and the client itself because they feel that they're just wearing a normal pants or underwear. Clients are happy with the program as well as the family member who can rest assured to engage in their daily routine with peace of mind. They are happy, we are happy, everyone is happy.
Disengaged staff, low productivity, remote working just made it worse, and it's here to stay. It's time to reinvent your staff engagement strategy in this new norm. Join ESG Virtual Wellness Series, a community initiative by ESG to help companies engage their staff and improve their well-being. A monthly series of live virtual events centered on medical or wellness themes by expert speakers. An all-in-one virtual experience for your staff to learn, play, shop, and interact. No conditions attached. Exclusive by invite. Free. No maximum limit or minimum staff attendance required. Sign up for ESG Virtual Wellness Series and be part of our growing community of 100+ companies and 100,000+ employees. Visit esgwellness.com